Hello, and welcome to the CardioSmart community on CardioSource. My name is Dr. Andrew Freeman, and I'm editor-in-chief of this new site. I'm joined today by Mr. Stephen Wilkins, MPH, thought leader and blogger at Mind the Gap blog on WordPress. Today, we'll be talking about patient-centered communication. Welcome, Stephen.
Thank you. It's nice to be here. Thanks for the invitation.
So today, you've spent a lot of time blogging and trying to get physicians to sort of see the light in patient-centered care. And we wanted to get a little bit of an idea of what this means and why it's so important, and maybe how we can implement this in our day-to-day practice.
Sure. Actually, the notion of patient-centered care and patient-centered communications is really not new. It goes back many years in the practice of medicine. But also in the research. Some 30 years of research have documented the fact that patient-centered communications, as opposed to what is typically called physician-directed or paternalistic communications, is closely associated with lots of good things: improved patient outcomes, improved patient adherence with medication and taking and treatment regimen, as well as less utilization of inappropriate healthcare resources, and with that, lower costs, and ultimately greater patient satisfaction and provider satisfaction.
Right. So an analogy of this would be sort of, there's a great large forest out there, and I'm your tour guide as a physician through the woods, but the path we ultimately take is really the patient's as opposed to mine.
Exactly. If you stop and think about the fact that when patients present to the physician, regardless of primary care specialist, they come with objectives in mind, and their needs and their objectives are also not just symptomatic or condition specific, but also previous experience. They come with fears, beliefs about medications, about what the doctor can do for them or not do for them, whether they have the disease that you tell them they have or not. And they call it the patient's perspective, and the patient's perspective plays a big role in determining things like compliance and adherence, utilization, and whatnot. So yeah, it's a matter of looking at healthcare beginning from the patient's perspective and then layering on the provider's or physician's perspective.
Well, but doesn't this take a lot of time? I mean, am I going to be bogged down in a visit spending 30 minutes making sure that I've gotten everything I need from the patient, or is it actually improving efficiency?
Well, actually, it's designed to improve and has been shown in the research to improve efficiency and visit productivity, and also satisfaction from the patient and provider's perspective. The reason why, and here's a great example, is that the notion of starting with the patient's agenda, why the patient's there, their beliefs, concerns, and whatnot, and a prioritization of those beliefs and concerns, often takes some 6 seconds longer than the traditional patient opening statement, which is often you hear referred to as being interrupted by the provider or physician within the first 18 seconds. So with 6 additional seconds, you get the added information from the patient's narrative, if you will. You also get, there's a therapeutic value to getting the patient's entire story. Plus, you get a lot more information that is useful in terms of, from a diagnostic perspective, which in turn then improves treatment efficacy.
Right. So most of us would actually want the patient to be much more engaged, because ultimately we're trying to heal and improve and prevent disease. And I think if the patient's engaged, we're much more likely to have them adhere to some of the things we come up with. Is that right?
That's correct, but I would introduce the notion, just a differentiation between the patient being engaged. Now, if you think about it, by virtue of the process they go through to show up in the office, I contend that many patients are already engaged, albeit just not in the way that providers tend to think of engagement. Many physicians tend to think of engagement as patients doing what we want them to do and what they should be doing. And patients present in doctors' offices oftentimes with their own ideas of what defines engagement. They come knowing that Uncle Bill had this same heart problem, and that he was able to deal with that heart problem and live to be 88 years old without ever taking medications, or so the story in the family goes. And so you've got a clash of perspectives that really define. So I make the case that rather than worry about engaging patients, providers and physicians need to be more engaging. That means they need to ask the patient their perspective. They need to engage in these patient-centered techniques like agenda setting and prioritization of what can have been accomplished in the visit. They need to, either in the case of one visit or over a series of visits.
Right. So it sounds like, in short, the patient and the provider together come to some decision about how to proceed in the patient's framework, if you will, and then and hopefully, because the patient has come up with this framework, the goals are met. That is, the patient's being treated appropriately. I would imagine that's the ultimate goal.
Yeah, that is the ultimate goal.
Okay, and so what are some practical pearls that we can take as physicians, as providers, to enable this type of a practice?
Well, the first step is to the use of open-ended questions right at the beginning of the medical interview, to literally ask the patient, why are you here? What brings you here? And let the patient finish the narrative before you want to jump in and get to the differential diagnosis. And after they've completed their narrative, ask them, is there anything else? And then the next step is, from there, construct the visit agenda and negotiate the agenda. The physician has priorities they want to achieve, the patient has priorities. And then set reasonable expectations for the amount of time. And what doesn't get covered in one visit can be addressed in the next. But basically be engaging. Invite the patient to participate, because most patients show up and are intimidated and are very passive, and they play what is traditionally called a sick role, which doesn't involve a lot of talking, and they let the doctor do the talking. So simply inviting the patient to participate will go a long way to achieve the patient-centered objectives we're talking about.
Okay, well, let's talk about some of the pitfalls. Every so often we get a patient who could spend 30 minutes telling you about their history and why they're at the doctor's office. I know I get those quite often. How do you sort of make sure to steer the conversation in the right way to make sure that you have a high-yield visit?
Well, there are patients like that, and again, it's up front. You make it very clear that you have a certain amount of time, and that's just the reality of care, and that you basically make it very clear to the patient that you have to achieve a number of objectives in that visit, and you're not going to be able to accomplish everything. And you simply come to a mutual agreement on what you will accomplish in that visit, and then get on with it.
Okay, well, I think you've given us a lot of perspective here and have really helped us to understand more of the patient's perspective and sort of using open-endedness to make that happen. So thanks so much, Stephen, for spending time with us today to tell us about patient-centered communication. Continue to tune into the CardioSmart community for more information on the value of patient-centered care. I'm Dr. Andrew Freeman, and I thank you for watching.